Welcome back to the Truth About Utilization Management, what every nurse needs to know, presented by Healthcare Nurses Network and Nurses Link Up. Last time, we focused on denial-proofing your documentation. But even the best documentation can fall short if communication breaks down. In Episode 3, we're tackling a relationship crucial to effective utilization management: nurse-case manager collaboration. You talk to case managers about discharge plans, you give clinical updates, but is it a true partnership? Dr. Nicolas Abella, in his third article, highlights the silo effect, where nurses and case managers operate separately, leading to missed opportunities, delays, increased workload, and even denials. It's a common source of frustration for everyone involved. Get ready to learn how to bridge that gap. James and Emily are here to discuss Dr. Abella's insights on moving from simple transactions to building a truly transformational partnership with case management. They'll cover recognizing shared goals, communicating proactively, and practical strategies to make collaboration work effectively. Here are your hosts, James Carter and Emily Ramirez.
Welcome back to the Healthcare Nurses Network podcast, you guys, where we're giving you the tools and knowledge you need to really thrive in your nursing career.
That's right.
Today, we're diving into something super important for patient care, but honestly, it can be tough.
Yeah.
Nurse case manager collaboration.
You got it. We're going to break down why those typical interactions sometimes don't work and how to make them into true partnerships.
Yeah.
Most importantly, we'll give you strategies you can use right now to improve that collaboration.
I love that. So we've got some research and real-world stories to help us out here. The goal is to really get why things get tricky between nurses and case managers, and figure out how to make it smoother. You know what I mean?
Mm-hmm.
We want to give you practical tips to make that collaboration work.
Because when nurses and case managers aren't on the same page, it's frustrating for everyone, and it can impact patient care.
Big time. It's like we're playing telephone and the message gets messed up each time. Not exactly efficient, is it?
Not at all. And that's what we call the silo effect. Each department's in its own little world, and communication breaks down. Tony Healthcare's research from 2023 found that a lot of delayed discharges were directly because of these communication gaps, often between nurses and case management.
Wow, that's a wake-up call. So how do we break out of these silos and start working together?
The key is to change how we think. Instead of just exchanging information, we need to be actively working together.
Okay.
It's about moving from just transactions to transformation. We're allies, not enemies. Nurses and case managers both want the same thing: the best possible outcome for the patient.
I love that idea of busting the us versus them myth. So it's about communication and perspective.
Definitely. It goes beyond just knowing what each person does.
Yeah.
It's about seeing the patient as a whole person, not just symptoms or a chart.
Right.
Nurses have the clinical picture, and case managers know all about resources and insurance.
Mm-hmm.
When you combine those perspectives, you get a complete view of what the patient needs.
It's like putting together a puzzle. You need all the pieces.
And speaking of the complete picture, I want to remind everyone to check out healthcarenurses.net.
Oh, yeah.
We have tons of resources to help you collaborate better, like real-world communication scenarios and tons of practical tips.
Great point. We'll give you more details on those resources later, but let's get back to how we can make this collaboration amazing.
Okay, so we're ditching those basic interactions. What does this proactive partnership actually look like on the unit? How does it feel?
It's about anticipating needs and roadblocks. Let's say you're a nurse and your patient seems hesitant to talk about their home life. That little detail could be a sign of social determinants of health things outside the hospital that could affect their discharge and recovery.
So you're saying it's about reading between the lines and sharing those observations with the case manager.
Exactly. Sharing that early gives the case manager a head start on finding resources and solutions before it becomes a crisis. We're talking about making the discharge smoother. It sounds like that could prevent so much of that last-minute scrambling and stress that our listeners are familiar with.
Absolutely. Another important part of this partnership is understanding the why behind the case manager's requests. When they ask for specific information or documentation, it's not just about checking boxes. Ask why they need it. Understanding their reasoning helps you give them more useful information, and it gives you insights into the big picture of utilization management.
So it's about being partners in problem solving, not just taking orders.
Yes. And that problem solving is key for documentation, too. Nurses and case managers need to speak the same language.
Okay.
This means nurses need to be comfortable with medical necessity criteria, basically making sure their documentation clearly shows why certain treatments or resources are medically necessary for the patient. This can be tricky when it comes to procedures that need pre-authorization from insurance companies.
Yes, pre-authorization, that can be a real pain. How can nurses make sure their documentation is good and helps the case manager?
One simple tip is to focus on clearly showing how the patient's current condition and limitations are directly affecting their daily life. Case managers can give feedback on documentation and help nurses understand what insurance companies are looking for. It's about teamwork.
It's a two-way street. So nurses need to understand those documentation needs, and case managers can help them get there.
Right. And that open communication has to go beyond just documentation. Ask questions, share your clinical expertise, and be open to learning from the case manager's knowledge of resources and insurance. It's a feedback loop where everyone is learning and improving.
It sounds like we're talking about building a culture of mutual respect where everyone feels comfortable asking questions and sharing what they know.
Exactly. When that happens, it totally changes the relationship between nurses and case managers. It becomes a real partnership focused on the best possible outcome for the patient.
I love that, a true partnership. It means moving away from that old way of working in silos and embracing collaboration where everyone feels valued and heard.
And when you do that, the benefits are huge. Patients get better care, nurses experience less frustration and burnout, and case managers get valuable insights from the front lines. Everyone wins.
Speaking of wins, remember those resources at healthcarenurses.net.
Oh, yeah.
If you need practical tips, templates, or even real-world scenarios to help you collaborate better with your case managers, you need to check it out. We have a free Nurse Case Manager Communication Toolkit that's packed with great info.
It's awesome, and it's free.
Yes.
We'll tell you exactly how to get it later. But now let's talk about some specific things nurses can do to make this collaboration happen every day.
I'm ready for the nitty-gritty. What can nurses do today to start building those bridges and stronger partnerships with their case managers?
One really effective strategy is having regular huddles. Short focus meetings, maybe 15 minutes at the start or end of each shift, where nurses and case managers connect to talk about all the patients on the unit.
Like a mini strategy session to figure out and tackle any potential problems proactively.
Exactly. A chance to share updates, voice concerns, and get everyone on the same page. By dealing with potential roadblocks early, you stop small issues from becoming big problems.
I love it. It's like a huddle before the big game. Everyone's aligned, sharing insights, and coming up with a plan.
I like that analogy. These huddles don't have to be fancy or take a long time. Even a quick 10-minute check-in can be really helpful in preventing miscommunications and delays.
These huddles sound like they could really streamline communication and create a more proactive approach.
Absolutely. And it's not just about finding problems. Huddles are also a great time to celebrate successes and acknowledge each other's contributions.
Building team spirit and a sense of shared responsibility for patient care.
I love it. That's what it's all about. When nurses and case managers feel like they're part of a team, it changes everything. It creates a sense of camaraderie and support, which is so important for truly patient-centered care.
That's the heart of it. So we've got these regular huddles to keep everyone informed and in sync. What other practical tips can nurses use to get better at collaborating? What if huddles just aren't possible on their unit?
Well, remember how we talked about understanding the why behind the case manager's requests? That's huge. Don't be afraid to ask questions and get more information. The more you understand their perspective and why they do things, the better you can help with the care plan.
It's about going beyond just following instructions and becoming a real partner in making decisions.
Exactly. And remember, you have valuable clinical experience to share. Tell the case manager what you've observed. You might have noticed something about the patient's behavior or condition that could be super helpful in figuring out the discharge plan.
It's about realizing that everyone has a unique and important perspective to offer.
And that brings us to another essential point, feedback. Be open to feedback from the case manager, and don't be afraid to give constructive feedback in return. Remember, it's a two-way street. Both sides need to be willing to learn and grow from each other. It's all about creating a culture of continuous learning and improvement.
Exactly. And speaking of learning and improvement, I want to highlight another important strategy for working together well using technology.
Oh, yeah.
These days, there are so many tools that can make communication easier and collaboration seamless.
It's about using technology to bridge the gaps and make sure everyone has the information they need when they need it.
Exactly. Think secure messaging platforms, shared documentation systems, even virtual huddles if meeting in person isn't possible. These tools help nurses and case managers stay connected, even when they're not in the same place.
Okay, I love this. It's about using everything we have to make collaboration efficient and effective, which can be really hard in a busy hospital.
For sure. And when we do that, we create a system where everyone feels empowered to do their best, which leads to better care for our patients.
That's what we're aiming for. It's about moving beyond the old ways of working in silos and embracing a new way of collaborating, where technology helps us break down barriers and work together smoothly.
Exactly. It's a win-win for everyone. Nurses feel more supported and valued, case managers have access to crucial clinical insights, and most importantly, patients receive the best possible care.
Okay, so we've covered huddles, understanding the why, sharing expertise, feedback, and using technology. What other tips should nurses keep in mind as they work on building these collaborations? What are some common mistakes to avoid?
One thing nurses often forget is to go beyond the usual shift report when they're talking to case managers. Don't just give a clinical update. Tell them about any problems you see coming up, like if a patient seems unsure about going home or if their family isn't very supportive.
Yeah, it's like looking ahead and pointing out anything that could mess up the discharge plan.
Exactly. And when you do share those concerns, be clear and direct. Use specific examples and skip the medical jargon. The case manager might not understand all those terms.
So keep it simple and easy to understand.
Right. And don't forget, communication goes both ways. Listen to what the case manager has to say, and if anything isn't clear, ask them to explain it. The more open and honest you are, the better your partnership will be.
So it's about building trust.
That's the foundation.
Mm-hmm.
And when you have that, nurses and case managers can be a great team working together to handle all the difficult parts of healthcare and make sure their patients have the best possible outcomes.
I love that image, the dynamic duo fighting for their patients.
It's powerful and it can really change healthcare.
So true.
Yeah.
We've talked about a lot, but I want to address something I know many of our listeners are thinking about, the challenges of making this collaboration happen in real life.
Definitely. Building these partnerships takes time, and it's not always easy. There will be obstacles.
Okay, so let's talk about those common roadblocks. How can nurses overcome them?
I hear we just don't have the time all the time. And I understand nurses are busy. Adding another meeting to the schedule can seem impossible. But honestly, poor communication ends up wasting way more time.
So it's better to invest a little time up front to avoid bigger headaches later.
Exactly. And those huddles we talked about don't have to be long or complicated. Even a quick 10-minute check-in can be super valuable.
It's about finding ways to make collaboration part of your routine, not an extra chore.
Right. And if you're really short on time, use technology to streamline things. Secure messaging can replace all those phone calls, and shared documentation keeps everyone updated without tons of emails.
Work smarter, not harder. Makes sense.
Mm-hmm.
What other challenges come up?
Another common one is the feeling that case managers just don't understand clinical stuff. That can create a divide and make nurses feel like their expertise isn't valued.
Oh, I can see how frustrating that would be, like they're speaking different languages.
It is. The key here is patience and clear communication. When you're explaining something clinical to a case manager, use simple language and avoid technical jargon. Remember, you're both on the same team with the same goal, the patient's well-being.
Finding that common ground.
Exactly. And if you hit a roadblock, don't be afraid to respectfully advocate for your patient and explain why they need a specific treatment or resource. You're their advocate, and your clinical knowledge is so important.
Using your voice and expertise to ensure your patients get the best care.
Yes. And remember, creating a collaborative culture isn't just the nurse's responsibility. It needs support from leadership and a commitment from the whole system.
So it's about making an environment where everyone values and encourages collaboration.
Exactly. Nurse leaders are crucial in promoting this approach, providing the training and resources people need, and recognizing successful partnerships.
Setting the tone from the top and giving nurses the power to collaborate effectively.
That's how real change happens. And when it does, you see amazing results, better outcomes for patients, fewer readmissions, and happier staff.
The triple win.
Absolutely. So to all the nurse leaders out there, please be champions for this collaborative way of working. The benefits are clear.
And to our listeners, remember, you can make a difference. Start small, focus on building relationships, and don't be afraid to speak up for your patients and your profession. By working together, we can create a healthcare system that truly puts patients first.
I love that. It's a reminder that even small actions can have a big impact and contribute to a larger movement towards more collaborative, patient-centered care.
And speaking of that, let's go back to those fantastic resources we have at healthcarenurses.net. We've mentioned the free Nurse Case Manager Communication Toolkit.
It's full of practical tips, templates, real-world examples. It's a goldmine.
It is. And we also have a bunch of articles and videos that go into even more detail about how to make this collaboration work.
We cover everything from communication skills to handling disagreements to building that team spirit we talked about.
So head over to healthcarenurses.net and check it out. You won't regret it.
We're here to support you every step of the way.
Okay, to wrap up this part of our deep dive, I want to leave our listeners with a question to think about. What are some ways your organization is already encouraging collaboration between nurses and case managers? And where do you see room for improvement?
Those are great questions to consider. Think about how you can help build a more collaborative and patient-centered work environment.
Your ideas and actions can make a real difference.
Remember, we're all in this together. By working together, we can build a healthcare system that truly prioritizes patients.
Well said. Now get ready for part 3 of our deep dive, where we'll look at some real-life case studies and hear from nurses and case managers who are leading the way in collaborative care.
It's going to be inspiring and informative.
All right, we're back for the final part of our deep dive into nurse-case manager collaboration. And we've got something special for you today.
We do. Today we're hearing straight from nurses who are out there on the front lines putting those collaborative principles into action.
I love real-world examples. They really show how this partnership can change everything for patients.
Absolutely. Our first story is about Sarah, a nurse on a really busy surgical unit.
Okay.
She kept running into the same problem. Patients with complicated needs were having delays getting discharged because the social work team wasn't involved early enough.
Ugh, that sounds so familiar. I bet a lot of our listeners have been there.
It happens all the time.
Yeah.
So Sarah decided to be proactive. She started a daily huddle with the case manager and the social worker. They just met for 15 minutes every morning to go over all the patients and identify any potential discharge issues right then and there.
There you go. The proactive approach in action.
Exactly. And it worked wonders. Getting the social worker involved early meant they could plan ahead, connect patients with resources, and avoid those last-minute scrambles that always cause delays.
It's amazing how a small change can make such a big difference.
It really is. And it wasn't just about efficiency either. Sarah noticed patient satisfaction went up too. Patients felt like their needs were being heard and they were more comfortable with their discharge plans.
So smoother discharges and happier patients. I love it. What other success stories do you have?
Let's move to pediatrics. We'll meet Emily, a nurse in the NICU. She was really passionate about making sure her tiny patients had a smooth transition home, but communication with the case managers was inconsistent and frustrating.
Oh, I can imagine how tough that must be in such a sensitive environment with those little babies.
It's incredibly challenging. So Emily decided to take charge. She went to the case management team and suggested something new: joint care conferences.
I love that she was proactive.
Me too.
Yeah.
And the case managers were totally on board. They started having these conferences twice a week, bringing together the nurses, doctors, case managers, and even the families to talk about each baby's progress and create a solid discharge plan.
That's a true team effort.
It is, and the results were incredible. Having everyone in the same room sharing information and concerns meant they could create a truly personalized plan for each baby, thinking about everything.
It's about seeing each baby as a whole person and remembering that their family is part of the team too.
Exactly. And Emily saw such a difference in communication and collaboration. The whole team felt more connected, informed, and invested in each baby's success.
It's all about building trust and understanding, isn't it?
Yes, and that's so important in these complex care situations. Okay, for our last story, let's see how technology can help with collaboration. This is David, a nurse in a busy cardiac unit. He was struggling to keep up with all the latest info about his patient's insurance and discharge plans.
Oh, I know that feeling. Trying to stay on top of the clinical stuff and all the administrative details is a lot.
It is. It's so much to manage, and things can change so fast. But then David discovered something that changed everything: a shared electronic documentation system.
Oh,
Nurses and case managers could both access and update patient information in real time.
there we go, using technology to break down those silos and make sure everyone is on the same page.
Exactly, and it was a game changer. David didn't have to waste time chasing down case managers or waiting for updates. He had everything right there, which meant he could give his patients better, more efficient care.
Love it, technology making life easier for everyone and helping patients.
Right, and it was a win for the case managers, too. They could see what David was observing and offer more specific support.
That two-way communication is so key. These stories are so inspiring. They show that nurses who take the initiative can make these collaborations happen.
They really are. And they prove that even small changes can have a huge effect on patient care, job satisfaction, and the whole work environment. It all starts with taking that first step.
And remember, You don't have to start from scratch. Head over to healthcarenurses.net for all those resources we've been talking about, like the Nurse Case Manager Communication Toolkit and those real-world communication scenarios.
They're full of helpful tips and strategies that you can use right now.
All right, before we wrap up, I want to leave everyone with one last thing to think about. What's one thing you can do this week to strengthen your relationship with a case manager?
It could be something small, like starting a conversation, asking a question, or offering to help.
Remember, every little bit counts as we move towards a more collaborative, patient-centered system.
We're all in this together, and by working together, we can truly make a difference.
That's a wrap for our deep dive into nurse case manager collaboration. We hope you're feeling motivated and ready to build stronger partnerships at your workplace.
We're here to support you every step of the way.
Thanks for listening to the Healthcare Nurses Network podcast.